Hey, today we're diving into the fascinating world of antidepressants and what happens when we try to stop them, sometimes called withdrawal, though it's not as fun as a vacation. First off, let's talk about SSRI, selective serotonin reuptake inhibitors, like fluoxetine, paroxetine, and venlafaxine. They work by increasing serotonin levels in the brain, helping lift mood and ease anxiety. But did you know that when you suddenly stop these medications, you might experience withdrawal symptoms? Think of it as your brain throwing a little tantrum, things like flu-like symptoms, nausea, dizziness, irritability, insomnia, vivid dreams, and even some weird sensations like electric shocks or tremors. Now, these withdrawal symptoms can be tricky. They often resemble a relapse of depression or anxiety, which makes it hard to tell if your mood is really slipping or just reacting to stopping the medication. That's why doctors usually recommend tapering off gradually, especially with drugs like venlafaxine or paroxetine, to give your brain time to adjust. Speaking of medications, some antidepressants are tricyclics or monoamine oxidase inhibitors like tranylcypromine. These can also cause withdrawal effects, sometimes more intense, including agitation, mood swings, and even physical symptoms like headaches or abdominal pain. Let's not forget benzodiazepines, which are sometimes used for anxiety, but can also lead to dependence and withdrawal issues. Why does this happen? Well, it all comes back to biology. Serotonin, norepinephrine, and dopamine are key players in our mood regulation, according to the monoamine hypothesis. When we mess with these chemicals with medication, our brain adapts over time, and suddenly stopping can leave it out of balance, leading to those withdrawal symptoms. Sometimes the severity depends on the dosage and how long you've been on the medication. Long-term treatments might require a slow taper, while intermittent use might be easier to discontinue. It's a complex dance involving biological pathways, genetic factors, and external exposures like stress or life events that influence vulnerability. Interestingly, depression rates have increased during economic recessions, possibly due to external stressors affecting our mental health. That's where psychological treatments come in. Things like cognitive behavioral therapy, behavioral activation, and interpersonal psychotherapy can be powerful allies, sometimes even replacing or supplementing medication. But let's not forget, stopping antidepressants should always be done carefully. Suddenly stopping can cause a rebound, relapse, or even exacerbation of symptoms. Sometimes switching antidepressants or adjusting doses is necessary, always under medical supervision, to avoid risks like serotonin syndrome, a potentially dangerous condition characterized by symptoms like agitation, tremor, sweating, shivering, dilated pupils, hyperreflexia, diarrhea, rapid heartbeat, high blood pressure, muscle rigidity, delirium, or seizures. So the key takeaway, if you're thinking of discontinuing antidepressants, do it gradually and with cautious observation. This helps prevent withdrawal symptoms, reduces the risk of relapse, and ensures your mental health remains on the right track. Remember, mental health is a complex puzzle. Biological, psychological, and social factors all play a role, and a careful, informed approach is the best way to keep your mind happy and healthy.